So our next speaker did send his bio almost on time. And I saw when I was looking for it, I saw I even answered, thanks for being on time. I will add it to the program I take with me. So it's my fault that Stefan was not on it. Our next speaker is Stefan Busche from Merck Healthcare Germany. Let's keep it this short. Stefan studied at the Eberhard Karls University in Tübingen in Germany between 1996 and 2000, and he did studies of chemistry. He made his PhD also at the University of Tübingen in Germany in the group of Professor Dr. Günter Gauklitz. He worked at Polytech, another spectrometer company, between 2006 and 2016, and in 2016 he joined Merck in Darmstadt, and today he is a PET lead expert for late-stage development in global drug product development. I guess there is an abbreviation for it, isn't it? Somewhere, somehow, next time.
There are a lot of abbreviations.
At Merck Healthcare in Darmstadt, Germany. Great to have you here, Stefan, and stage is yours.
Yeah, thanks for inviting me. So I hope you can hear me loud and clear. So I will give a short presentation on our NRR-based PAT for our small-scale continuous manufacturing line, and we really see it as kind of a backbone of this continuous manufacturing line. So, but before going into details, how is this intended to work? Okay. Okay, thank you. Yeah, so why and how do we do continuous manufacturing? So I mean, I don't need to go too much into detail, but of course we see it still as innovative, and we definitely need a PAT for implementing continuous manufacturing in our fields, and gathering a lot of data and collecting a lot of information on our products. And this will also, of course, help us to increase the quality, and especially help us to understand our processes. And yeah, we do it, of course, also to reduce our costs. So we have the promise from continuous manufacturing that we need less API, especially during the development of the process. And yeah, that will help us to save a lot of money. That's why we are going this way, of course, and also we are reducing less waste and have a reduced footprint of the continuous manufacturing line itself, and it gives us a certain flexibility of manufacturing by having the line running longer, for example, or yeah, rapidly responds to some drug shortages or and so on. So I guess I don't really need to talk about this slide here. So I guess you all know more or less the differences between classical batch manufacturing, which is still all commercial manufacturing at the moment for drug for tablets at Merck, but we clearly see the future in continuous manufacturing, where we can react much faster, and we hopefully can come from powder to tablets or even coated tablets within minutes or at least hours. So nevertheless, there are different strategies for continuous manufacturing. So you could yeah, do some direct compression, which is here on the left-hand side. That is one option we have. But for us, the most relevant one is to do some granulation step in between. So we are more or less in the middle with our continuous manufacturing line. So we are going for yeah, continuous twin screw granulation, followed by continuous drying. And that's where I want to focus on today. So there's also the option really going from drug substance to drug product, but that turned out, at least for us, as much too complex. So that's why we keep continuous manufacturing to the drug product, at least in our department, and that's where my talk is focusing on. And yes, we are implementing a Cubicon 1 full Conti line. So that means we implementing a small-scale continuous manufacturing line for manufacturing of clinical trial material. And basically, it is able of handling twin screw granulation and direct compression with an throughput up to 4 kilograms per hour. So it's even much smaller than what Marnell was presenting this morning. We can handle substances up to OEB4, which means we need to take certain safety measures. So the complete line is housed into an isolator you see here. And yeah, it's not we call it full continuous. Nevertheless, we are starting with some pre-blend here. So this is a little bit due to the restrictions we have in space for our line. So we put a container with a pre-blend on top of the line. And of course, we are also using PAT to monitor this pre-blend because we see it as crucial that it is homogeneous when we put it on top of the continuous manufacturing line. And after the powder enters the line, we going through the transfuse granulation followed by a continuous drying step. And there we have also a near-infrared spectrometer positioned where we monitor the remaining moisture of the dried granules. And then the granules are transported by vacuum to the addition of the external ingredients. And during this vacuum transport, we are looking via an Malvern Inzitec on the particle size distribution because we especially see these two parameters, the remaining moisture and the particle size distribution, as the critical ones when transferring the product from our development line, which I will also show you a little bit later, to the line where we manufacture the clinical trial material. And yeah, then we add the additional phase. We have a blender, and we have another NRR channel here directly in the tablet press in the feed frame. That's more or less looks like Manel has shown this morning also. And yeah, we are looking on the blend uniformity directly before it gets turned into tablets. And as last step, which is again a batch step, we have a coater to put a film coating on the tablets where we can monitor by Raman the coating thickness. Yeah, basically when looking at which PAT instrument using for what, so especially we distinguish between development and GMP manufacturing. And for development, we have more PAT installations than for the GMP manufacturing, because for us it's of course critical to learn our process as good as we can. So we have the pre-blend. So this is more kind of also replacing the sieve sampling from the container, but it's more of making sure that the material coming into the line is really homogeneous, because if it is not homogeneous at that stage, it will never be turned into tablets with the right content uniformity over the batch. And of course, yeah, what is then coming then, it's the loss on drying at the end of the continuous dryer, and this is a very critical point for us, and we will use it during the GMP manufacturing as well as during development, of course. And of course, we also use these measurement position to measure the residence time distribution of the continuous twin screw granulator and the dryer. And we are following different strategies there. So we are doing it with chemical tracers, but we are also doing it with color tracers. And as we have the Centropat FO, the probe mounted at the end of the dryer, so we keep the probe there, but in some cases we will also put some UV vis spectrometer instead of the NRR spectrometer to monitor the color impression of the granules leaving the twin screw or the dryer, but I won't go too much into detail today. Next step will be the particle size distribution, which we potentially will use for doing GMP manufacturing. We are not that decided because that might depend on the product, so how relevant this is for a certain product. And we have, we have another channel here directly after the continuous blender, which is only for development because we want to monitor the material leaving the continuous blender, also by NIR, also for residence time distribution, but also for content uniformity, of course. And then, which is also for development and GMP manufacturing, is the measurement position on the tablet press. So, and there we have also, of course, the need for measuring residence time distribution, but also content or blend uniformity during the tableting process in development and also GMP manufacturing. Okay, what does it mean when we look into more detail? So we have 3 pillars, more or less. We have the PAT systems, we have a PAT data management system, and we have the CM line on the other hand side. And yeah, we have quite some PAT systems here. We have the PAT management system in the middle and the CM line from Boli on the right-hand side, and everything is, of course, connected, and we can bring data from left to right and from right to left. But one thing is missing here still, so that's the chemometric part, so the multivariate analytical method, and of course also everything is also linked to our OSIPI and the MES. And on the first step, I want to focus here on the SynTQ, including the multivariate method part. And as we are currently starting up our line and will go to qualification soon, we're already starting with building first orchestrations, and of course we bring in the PAT instrument, in that case the Centropart FO spectrometer, and we put in some, in that case just a dummy chemometric part. So that's something I want to show you a little bit more in detail, because at that stage we are going for a tailor-made solution based on Python. So it's an in-house developed chemometric software for predicting CQAs, but also for validation of the PAT methods. And we are then sending the predicted CQAs to the Cubicon full Conti line. And for building the chemometric models, as mentioned, we have these so-called PyPat software. So it's an in-house developed Python solution, which is shown a little bit more in detail here. So it's the software itself, or software solution, is here in the middle. It depends, it is composed of 3 parts. So it's a module for the method development itself, but there is also one part for the validation module for GMP, and we have an application module, so which is for predicting historical data, or for doing maybe some non-GMP stuff. And of course, it comes with kind of an administrative part for user accounts and also audit trail. But basically, it should incorporate the input data, meaning the spectra from the different spectrometer we have, or also maybe the PSD data if needed, and of course the reference values. And then it enables method development, for example, PLS methods or moving F-test methods. And when these methods are developed within the software, it can be moved to the validation stage, where you then can import a validation data set and validate the data set. And when it's hopefully validated, you can use it for GMP purposes. And in the end of the process, it can export the validated method to be used in SynTQ. So that's our concept for the multivariate analytical method. Coming back to the PAT systems, I have brought 2 examples. So one is an example for the Cubicon line. In that case, not for the one I've shown you before. That's our small scale rig for development we are using in our non-GMP technical area. but nevertheless, we use it quite heavily to starting the process development, looking into the processes, also collecting data for model development or method development. And the second one is the implementation in the tablet press, and you also see it's not the one from before. It's an example where we have used the Centropad FO on an fetted tablet press. So coming to the first example, which is the moisture content of dried granules. So of course we are measuring on the outlet of the continuous dryer, which is shown here. So we have the powder feeding, the granulation step, and the drying step, and the spectrometer itself sits here where it's called position A. So directly before the dried granules leaving the CM line. And on the PAT method we will develop, it will help us to decide if we need to discharge the material or if we, for example, need to change some settings in the machine, which could be, of course, the dryer settings or the granulator settings. And there are many settings we could influence theoretically, and to decide which are the relevant ones for us, I've brought an example for an design of experiment which was supported by near infrared. So we have 7 factors for the DOE, so that means this was quite a large DOE, and we have, for example, settings for the twin fuse granulator. So we have the powder feed rate, the screw speed, the liquid solid ratio, and the barrel temperature. And we could imagine that some of them will directly influence, for example, the moisture of the material leaving the machine. And we have some parameters for the continuous dryer, for example, the inlet airflow, or the inlet air temperature, and the vibration acceleration, which is describing the parameter how we process the granules through the dryer. And of course we have a certain range. So as mentioned, we are running up to 4 kilograms per hour. So our minimum in that case was 1 kilogram. We have a certain liquid solid ratio and some upper and lower limits for the DOE range for all these 7 factors. And basically we did some pre-screening because it was clear from prior knowledge that we can't run all of these combinations. So that means the DOE is getting even more complex because we cannot combine, for example, a very high powder feed rate with a very high addition of liquids and a very low temperature of the air for drying that granules again, because it will not work out, so the machine will get blocked. That's why we had to add some constraints, so cutting off some edges of the DOE, which is then getting statistically quite complex. Nevertheless, we've managed it more or less, I hope so. And then we did the real DOE, the granulation, and there we of course have then the near infrared system based on the line and measured the moisture of the material leaving the machine. And of course the process change is going on. So we also did IPC on granules. We did also make tablets and did also IPC testing on the tablets. So I won't focus on that. I've just brought the example for the prediction or for the NRR predictions of the moisture content. And you see already here, so we have set some target, which was quite low, 1.5% or so, and we have an upper and lower limit we want to meet. But even after having introduced these constraints, you see that we have still some of the points of the DOE which are much higher than the maximum limit we want to have. It's not bad in that case because we can process this material, but we don't looking for, I don't know, an LOD value of 8% of our dried granules. So that's much too wet. We cannot even store it for a couple of days because Nevertheless, we have evaluated this data, so the center points are not that super accurate, but it's okay in the end. And we clearly see that we have factors which are influencing the remaining moisture. So, for example, the addition of the liquid-solid ratio, which is the addition of the water we add to the formulation, is directly proportional to the outcome of the granules. And we see that we have a certain correlation to the feed rate. So the more material we get in, it gets drier. That's a little bit surprising to us. And of course, we have also parameters for the dryer. So for example, we have the air volume, the temperature, and also the vibration acceleration. So the faster we are processing the material, the less time for drying we have, of course. And so it's quite plausible. And we don't have, for example, an influence of the barrel temperature or also of the screw speed, which is not significant in the end. So that's an example how PAT can really help us in supporting the process development. So, and the second example is the near infrared in the feed frame of a tablet press. That's more or less similar to what we have already had this morning. So we have put the sensor head here inside the tablet press, and we want to directly measure the blend uniformity on the feed frame of the tablet press. And basically, our idea was also a little bit to compare different ways of evaluating the data. So we did it in a qualitative way by a moving F-test. So here we have the spectra collected over time, and also the pre-treated spectra. And then we decided for using a block size of 5 for the moving F-test. And we see certain peaks where we get some disturbance inside the tablet press, but that was really a stop of the tablet press during the process. So it's maybe not so super helpful looking at the peaks, because you would notice anyway when the tablet press stops, but maybe we will investigate this further with additional trials. But also we did some quantitative evaluation. So we did a PLS regression, also sampling, having prepared some samples and built a PLS model, which looks quite nice. It's already it's only using one factor, and we can directly predict the API content. And here we also see the stop of the tablet press in this position and this position, and it's more or less constant. It's only going a little bit down at the end of the process. So that's something we want to investigate further for the future. So to summarize a little bit, I've shown you the applications of the near infrared for as a backbone for our small-scale continuous manufacturing line. There are a certain more PAT tools implemented in that line, but of course we are also facing some challenges. So this could be the interfaces, and that's not only the technical interfaces, it's also the interfaces to colleagues from the Q organization or also from analytical departments. So that really needs to take into considerations and need to be discussed. The DOEs can be quite challenging, especially if you make them too large. So, but could be good to do it for a screening DOE to get together first information on your system itself, and then come back with smaller DOEs with less factors and look deeper into it. The system is quite complex, especially the in-house continuous manufacturing line I've shown you. It's a different way of working, because you cannot easily assess the manufacturing equipment, and of course system integration always gives a certain challenge to you. And with that, I would like to thank you for your attention, and open for your questions.
Thank you, Stefan. Great talk. Interesting
Thank you.
talk. Time for 1, 2, 3 questions, if there are any.
Thank you, Stefan. I was interested in the throughput of that system at only 4 kilos an hour. So is that a pilot system that you would then feed onto a bigger rig?
Yes, that's the plan. So that's for clinical trial material, and of course, when it comes to, I don't know, phase 3 or then marketed products, we want to upscale it to the next larger machine from Bolus, so to 25 kilograms per hour. So that's the plan for the process. Yeah. So.
Do you plan to have automatic feedback from your PAT measurements to the process parameters?
We are prepared for it, definitely, and we want to have it. So the question is, when is the right time of doing it? So so as the question before, so we are planning to use also continuous manufacturing for the marketed products later. Maybe it's because we then have much more knowledge about the process. So maybe we will go for the control loops there and maybe not here. But of course, so technically we are absolutely prepared for it. So, and maybe we will do it for the projects, maybe not really for the first one, but maybe for the second or third, I don't know.
Thank you. Any other question? I'm trying to, yeah, here. Two more. Let me think about that.
Thank you, Stefan. Maybe an ignorant question. When you're doing the DOE, when you reach steady point on the first point of the DOE, to go to the second point of the DOE, do you do shutdown and start up, or do you switch without shutting down?
We switch without shutting down, but we took the parameters from the machine to see when it is stabilized again. So, for example, we looked at the product temperature, which is also so measured. It was not shown, but yeah, and it took quite some time to stabilize, especially when you have quite a span from one DOE point to the next. And so it could take, I don't know, when in the best case it was, I guess, 10 minutes, and in the worst case it was something like half an hour or so.
Quick one, yeah. Well, thanks for the nice talk. I have just a clarifying question about the GMP applications you mentioned about Centropate in the trying, right? And also in the feed frame for clinical campaign. So does this mean you have qualified instruments and validated PLS models during development for clinical supply, right?
Yes, that's the plan, yeah. So we will, so it's not we don't use the outcome of the PLS predictions not as release relevant, so it's not a method rated as high, it's a more medium impact model, and but general, that will be our plan to do it, yeah.
That makes sense. No,
yeah.
Thanks.
Yeah, as expected. Okay, thanks again, Stefan.
Yeah.
I can't clap my hands, so.